Thank you for inviting me, and my respects to everyone in the room. The first part of the session will be a bit dark, like those clouds, but luckily there is a light, and it will come in the second half. And so I'll talk for 10-15 minutes and just give a quick overview of lung cancer, and then I'll ask Archie, to bring some light to the topic. And so lung cancer, you've already heard, is the commonest cause of death from cancer, and it kills more people from cancer than many of the other cancers combined. And that's partly related to the fact that it's a common cancer, and that relates to environmental causes such as tobacco smoking, pollution, asbestos exposure, and other factors that we're yet to discover, but also because the outcome of lung cancer is much poorer than most other cancers. And unfortunately, the cure rate from lung cancer is only around 15%. We've become aware, although we think of lung cancer as being a smoking-related disease, we've become aware that about a quarter of lung cancer cases are occurring in non-smokers or for reasons other than smoking. And we became aware of that initially in women, but it also applies to men. And the non-smoking type of lung cancer has a different genetic background to it, and probably different causes. And there are some important causes such as exposure, particularly to women, of indoor pollution in cooking fumes, and certainly traffic pollution is now known to be a cause of lung cancer. I'll come back to this because the genetics are different, and we've now got some new treatments aimed at some of these mutations. You've already seen a slide on the biology of cancer in general, and lung cancer follows that general biology in that there is a target cells that are the lining cells of the bronchial tree, and those cells become exposed to something that irritates them, either tobacco smoke or polluted air, and that is like rubbing the skin. It irritates the cells. The cells start to divide, and while they're dividing, the DNA in the cells opens up and becomes exposed to carcinogens in tobacco smoke or pollution. And those carcinogens then cause mutations to important genes that regulate the growth of cells. And again, I mention this because it's these mutations that we now have drugs that can target, and these drugs tend to be more effective and more selective than chemotherapy. A series of mutations occur over time, and these mutations cause the cancer to grow and then for the cancer to spread. The immune system in all of us is very important for correcting and mopping up cells that have got mutations. And as a general rule, it's important that we maintain our immune system to be as strong as possible. And the best way to do that is to do what your mother told us all to do, which is to get adequate sleep, adequate exercise, eat properly, to have a positive attitude, and to relax as well. And we've already heard those comments today. Most lung cancers, when they're detected, have already started to spread, and that limits our ability to treat them, and that's one of the reasons that the cure rate from lung cancer is so low. So only about a quarter of lung cancers are detected at an early enough stage for the person to undergo curative surgery or curative radiotherapy. And hence, there's an intense interest in screening for lung cancer. And recently it has been shown that for very selected groups of people that screening might have a benefit. Now, this has been applied in America. It hasn't been applied on a wide scale in Australia, although there is a limited trial in Queensland. It's being performed by Professor Quan Fong, who's is in the audience and is a world expert on this. And so Australia is certainly looking at the feasibility of screening for lung cancer. Lung cancer can present in a number of ways, but by far the most important symptom is a new cough. And I've been listening to everyone's cough this morning, and 99.9% of those coughs will be due to a respiratory infection, will be due to drinking too much coffee and having reflux, or in some people, they've forgotten to take their asthma treatment, right? So most coughs, it looks like I've got someone over there, most coughs are not due to lung cancer. However, someone who's been a heavy smoker, or and still is or has been, who develops a new cough that continues for more than a week or so, or has a cough that worsens, is different from usual, must see their healthcare worker or their doctor or whoever, and we'll come back to that. Other symptoms can also be manifest as presentations of lung cancer. Confirming the diagnosis requires getting a tissue sample, and in the large majority that is a day procedure under local anaesthetic in hospital. So if there's fluid on the lung, we can stick a little needle in and take a sample. We can also put a needle into a lesion that's close to the lining of the lung, or we can use a telescope and look into the lung and take biopsies. I've had a couple myself without anaesthetic, there's no discomfort. And we've even got GPS systems now that can guide our telescopes to the right spot. We've got needles that can go into the centre part of the chest and avoid that other pesky organ. Does everyone know there are two important organs in the chest? So there's the right lung and the left lung, and then there's that other thing, just the pumping thing. So once we've made a tissue diagnosis, and the majority of lung cancers, 90%, will be a type of cancer called non-small cell lung cancer, and there are subtypes, squamous cell and adenocarcinoma. There's a small number that are small cell lung cancers that have a different type of treatment. But once we've established a diagnosis, the next thing we need to do is to determine how far the cancer has spread, and that's called staging. And there's a special way of staging depending on the size of the tumour, which is that blob in blue, whether it's moved to the lymph glands in the chest or in the neck, or whether it's actually spread to the rest of the body. And the degree of spread determines the type of treatment that is most effective. And staging these days is normally due to a combination of a CT scan and a PET scan, and they can often be done together. I was going to say in the one sitting, it's actually a lying down in a tube. So this has been mentioned for breast cancer. Once the tumour has been diagnosed and staged, a multidisciplinary team come together and give an opinion about the best care. Now, I should talk about the golden rule. Does everyone know the golden rule? Yeah, we used to teach medical students the golden rule, which is, treat people the way you'd like to be treated yourself. But of course, we now teach them the platinum rule, which is to treat people the way they want to be treated. So although we work out the diagnosis and the staging, we also have to talk to the patient and find out what their values and wishes and aims of treatment are, and that'll come up when we speak with Archie. And these are the range of management options that we've got. Surgery, and that's actually a whole left lung. The white stuff down the bottom is cancer in the bottom of the left lung, but we had to take the whole lung because it was beginning to spread to the centre part of the lung. And you can see that a lot of relatively normal lung tissue has had to have been taken out in order to remove all the cancer. And that type of treatment is only available to a relatively small number of people because the cancers often spread beyond an area that we can remove. It also depends on how strong the remaining lung is, and because smoking is a factor both in lung cancer but also in emphysema, sometimes there's also emphysema. A curative option that can be used if surgery can't be performed, either because of lung issues or heart issues, is high-dose radiotherapy, and there's a special type of radiotherapy now called stereotactic radiotherapy, and cures do occur with this type of treatment. Radiotherapy can also be used to bones and brain and other areas in cancer that's already spread to relieve symptoms. Chemotherapy is used in lung cancer. It's not as effective as it is in some other cancers, but it's certainly used to reduce symptoms, and it does have an effect on prolonging life, although we're talking months rather than years in people who've got widely spread cancer. The big hope now for treatment of people who've already got cancer that's spread are treatments against specific mutations. So this is called targeted treatment. That was mentioned in the last talk for breast cancer, that there's a very effective drug for breast cancer called Herceptin that targets a particular mutation. We've got the same type of treatments in lung cancer, and they can be very effective, but only if the mutation is present in that particular case. And so we now routinely test all the tissue we take at the time of diagnosis for these mutations, in the hope that we might be able to use this as an option. This is really important. So regardless of the specific treatment, there is strong evidence that supportive treatment, or it's sometimes called palliative care, but it's probably better called supportive treatment. So doing all those things that your mum would have told you to do, accepting support from your friends, taking a mindful approach, a holistic whole body approach is very important, and there's good data that it actually affects outcomes and not just makes people feel a bit better. Maintaining meaning in life. You know, all of us have to maintain meaning in life. This is quite a nice little sort of 4-point way that we do it. You know, self is most important, although we can lose self-esteem at various times in our lives, particularly when we're sick, but also with relationship breakdowns or losing our job. Relationships with family and friends and society is important. Spirituality is very important, in belief systems. And then the one that I wasn't aware of, but is attachment to nature. And you know, if we all think about it, we'll all come up with different ways that nature's important. You know, I like being on the ocean. The next person I spoke to likes animals. The third person I asked about this said, oh no, I walk out at night and I look up at the stars and I think, you know, I'm just a small person and it's huge. So, you know, staying connected with nature. And of course, if you're in a hospital, there is no nature at all. There are just walls. Although, interestingly, if you walk around a hospital, often people have put up pictures of trees and mountains and stuff. I'm almost there. Smoking cessation obviously is very important. Nicotine is a very addictive substance, and to break that addiction is very difficult. The way I did it, because I unfortunately was a smoker, was I stopped on the day I got married, and I said I couldn't bear the thought of not smoking again. So I said, look, I'll start again when I'm 75. It's getting pretty close. But there are proven ways to quit. And there are specialists in this area, and people who are smoking, who are addicted, you know, must be encouraged to stop, and they must be referred to specialists who can increase the chances of quitting. Government is playing, you know, a very strong role in tobacco control, and this is interesting data. California 30 years ago took their own idiosyncratic approach to tobacco control. They taxed tobacco double the amount the other states in America did. And there's now data coming out 30 years later that there are fewer lung cancers in people living in California, and there's increased survival in people living in California. Australia, of course, has taken its own approach, that's very important, and is now being followed by other countries of plain packaging. But all of us have got a role in tobacco control, and advocacy is really important, and we can all encourage people to quit, and the organisations that we work for and with need to be encouraged to have a no smoking policy. So that was the dark bit, now the light bit. Archie.
Just as Archie's coming forward, I'll give a little bit of a brief introduction. And Archie is someone most indeed doesn't need any introduction, not only amongst Aboriginal and Torres Strait Islander communities, but also nationally and internationally. Archie Roach's career has spanned 3 decades. His work has been recognised locally and internationally in mainstream and also Indigenous, non-Indigenous circles. Archie has shared the stage with some of the world's most iconic artists, and there's a whole list of people. He has released 10 albums, and this month Creation, a box set retrospective of his first 4 albums, has also been released. His music speaks the stories of his people, of this land, and of the human condition. In the 3 years preceding the release of his 2012 album, Into the Bloodstream, Archie Roach faced unimaginable challenges, including a stroke, lung cancer, and the loss of his partner in life and music. The new album did not dwell on tragedy nor lean on the oppressive legacy of his career. Hailed in many quarters as a rebirth, the album proved Archie Roach was as relevant in 2013 as he was with his debut album, Charco Lane, more than 20 years ago. So without further ado, I'll invite Archie Roach to the stage.
I'll sit down.
Yeah. Archie, I haven't shown you the list, but there it is. What's that? It's behind us. All right. You feeling okay?
Yeah, I'm good.
You happy to talk?
Yeah.
It's different from when we first met.
That's right. Yeah.
Different. I'm more nervous than you are, and you're used to having a microphone in your hand.
Yeah, that's right. Yeah.
So Archie, I had sort of sketched out a sort of a journey, sort of a chronological, but I'm sure we'll meander around, and I'd be very happy for people to ask questions and make comments as we go, and I've got no understanding of time, but I'm sure something will happen. But Archie, certainly the warning signs are very important, and this came on top of 2 other tragedies for you. So what was did you actually have a feeling? Did you develop any symptoms? What actually alerted you to the fact that you might have a lung cancer?
Well, actually, it alerted my friend and manager, Jill Shelton, because coughing, because I used to smoke. I was smoking since I was about 14 when I was in high school, and like most young fellas down behind the shelter shed, and so I'd been smoking for a long time, and but I stopped when I had the stroke in 2010. I quit smoking. It wasn't, I suppose, that. It could have been hard for some people, but I did it cold turkey, as they say, and I don't know what it is about those cold turkeys, but they mustn't get any assistance at all or something. But yeah, and but like I found myself in 2011, well, even in 2010 and 2011. I'd just go for a walk up the beach or something, and I'd be totally out of breath. I'd have to stop and gasp and hack a bit, and you cough and thinking, but I didn't. You just gather yourself and just continue and just think. I really didn't think much of it. I think, I thought, well, I had coughs before. I've been out of breath before. And so, it'll pass, especially me, my brothers, people that I've known for the years, especially Aboriginal men who, we really don't bother about, ourselves that much. I think, it's something that we don't think about. Going to see a doctor's, you just wait until you probably, collapse. It's about the only time you go to your doctor. And then if you collapse, somebody else that'll usually take you. But Jill Shell, she's a good friend of mine and helped me through these years. And she just mentioned my local GP, that something might be wrong. Yeah.
Yes, I asked Jill about this, and Jill actually had a gut feeling, and my scientific colleague, Professor Fong, mightn't like me saying this, but gut feelings, emotional intelligence, we should live by them at certain times, and Jill had this feeling that Archie should see his GP, and I should say that dogs can be trained to sniff for lung cancer. So, I'm not suggesting that Jill's a sniffer dog, but she, but she encouraged Archie to see the GP. Archie, was it hard seeing the GP?
Well, it's just going to see your local GP just for minor stuff. You go and takes your blood pressure and your temperature, your weight, and it's I say, yeah, it's not too bad, it could be better, but, it's not too bad. I said, well, thanks, Doc. So you go out and say, well, there's nothing really wrong. And yeah, it's, but it was, so that's what I did, actually, when Jill had a word with the doctor, not with me. She told me, my local GP, she said, I think you may probably give Archie a chest X-ray. And when he said that, I was because I thought we finished blood pressures. Yeah, it's not too bad. Weight, could be down a bit. And everything else. I said, so I was about to say see you later and walk out. And he said, oh, hang on, we'll make an appointment for a chest X-ray. I go, what? He said, for a chest X-ray. And it's something that I probably wouldn't do. I say, Doc, I need a chest X-ray, even though I was feeling short of breath at times, and had this cough. But like I say, a cough's a cough. I couldn't tell if it was different or not. And so yeah, it was I suppose it wasn't hard. I'll just have the chest X-ray then, and that was it.
So the chest X-ray showed a spot.
Yeah. And
then you ended up at public outpatients, Royal Melbourne Hospital, Friday morning.
Yeah, that's right. Yeah. And
was that scary?
It was. When the doctor comes back and says, we took a chest X-ray and we just saw this shadow, a shadow, and what does that mean, And you start having all these thoughts, and he said it mightn't be nothing, mightn't be anything, but we're going to have a few tests, and over a period of time, it took a while, and doing all sorts of tests, but we finally went to Melbourne Hospital, where you are, and yeah, it was very scary not knowing. And if it was cancer, then that's it. Just pack up your bags and leave, and just just close the door, lock yourself up, and you know, that's it. That's the end of you. That's the death sentence. Yeah.
So it did turn out to be cancer after a period of a difficult time, really, when a number of tests have to be done and no one knows, and it's difficult for doctors because we feel as though we're keeping information, but we're not. It's just that we can't answer questions because we don't have the details.
Yeah.
So we got all the tests done, we got the details, and then there was a discussion about surgery. And what were your thoughts?
Yeah, well, I was, they talked about radio, what was that?
Radiotherapy?
As well, so there's two options. But then I talked about surgery, and I thought, well, what would that be? And they said, oh, well, we'd cut out your cancer or remove part of your lung. And I just thought, no, whoa, because I sing. I sing for a living. It's not just your voice, but your lungs that helps you to sing. And so I was very apprehensive of thinking about surgery, of having surgery, because I was frightened, whether I'd be able to sing again or not. And that was a real big worry for me. Yeah.
I was very lucky in that a year or so previously I'd had a young lady who'd never smoked who unexpectedly turned up with a lung cancer, and she was a professional tuba player, and she had to have her whole lung removed but was able to still play the tuba. Tubby the tuba was her favourite piece, and so she continued to work. And I was able to tell that story to Archie, and I think that's probably what got you over the line.
It did. I said, because the air that it has to take, they have, to play a tuba, that would probably be incredible. So it certainly helped me decide to go with the surgery, that's for sure. And to hear a story like that, it's because you don't know what to expect, and hearing that, I said, well, I don't play the tuba, but I certainly should be able to sing, just with half a lung removed. Yeah.
Another issue that came up at the time was that Archie expressed much more concerned about other people in his life, and including people who were dependent on Archie, and that had to be discussed before you agreed to treatment.
Well, that's right. I started to worry then about, as we do, about family and about people, because I'd made a name for myself in music, and become famous, but your relatives, they seem to think that fame means rich. It doesn't. It's sort of like lifestyles of the poor and famous. And but you get by. But people still, your kids grow up. My children, grow up. They're men, grown men. And hairy fellas, and they you never stop looking after your kids, no matter how old they get or how old you get, so they always are, there's always, especially when your grandchildren are involved, and it's not so much for your children, it's for your grandchildren that you give them money. So financially, they the people, they're always asking for money here and there, and but you give in, you buckle. That's the way we are, we go without. I was taught that from my aunties and little women, little nothing to them, with their sons and their daughters are big, healthy looking people. I think, how come that? It's because Mum went without, and that's the way we are. And I was worried about that, Dr. Irving. I was worried about people that relied on me, and I wasn't sure, going through surgery and going through this, that if they'd be all right. And you always worry about your family.
Yeah, although not many people give as much as you do, and so we almost got tripped up because I hadn't picked up that you'd been an organ donor.
And,
That's
right.
And so that caught me by surprise with some unexpected blood tests.
Yeah, so my brother was on dialysis, and his kidneys had just withered down to nothing. And so I donated my kidney to my brother years ago now. And so I've got one kidney, 1.5 lungs. So I'm not all there.
So Archie's got a heart like an ox, basically, and we tested it before the surgery, and it got him through surgery and then radiotherapy. But the concept of being able to continue to live your life, you've got to come to the pesky hospital every now and then for a checkup.
Yeah.
But how do you get on with your life?
Well, I think for a long time, when I was 3 when I was taken away from my folks, I'm a stolen gen. And I've lived with that for a long time. And I still live with it today. And but I think, when you realise, because it was early, you caught my lung cancer early diagnosis, and it was for friends like Jill Shelton and yourselves and team around us, it could have been different. I mightn't even be here talking to you fellas, and that when I actually realised, when that sunk in, I thought, God, I'm alive, I'm here. I've carried this pain of being taken, being stolen from the family, and always railed and shook my fist at people and the government, and I didn't realise that, even though I'm a quiet fellow, but this rage that I had was also no good for me. So this album that I'd done, Into the Bloodstream, after we had the operation and the surgery, and I went into the studio and I thought, I've got to start talking about overcoming, talking about healing, singing about that, talking about, what we have, the spirit and resilience of not just myself, me and my people. We're still here after all these years, and we're going to be here for a lot longer as well. And that's what we've got to be, we've got to rejoice at that and sing about that. The strength, the spirit, and the resilience of your people. Sorry. Yeah.
So Archie and I catch up sort of every 4 months or so, and I clearly get much more out of it than Archie does because he's cured and things are good. Have you got time for some questions or comments?
Yeah, no, I'm right. Yeah, I didn't expect that, but yeah, I'm right. Yeah.
Actually, just while we're waiting for a question, Archie, can I just, and I know it's not easy, but in fact, the power of talking, and when we actually first met, it was almost like something out of a film. Archie was in a clinic room. There were 3 or 4 or 5 specialists all saying, have surgery, have radiotherapy, have chemotherapy, do this. And Archie, I saw you 2 or 3 weeks in a row, and each time Archie didn't speak. And I couldn't understand why that was until we actually had a discussion about the other things that had happened in your life.
Yeah, exactly.
Particularly with your partner.
Yeah.
And once Archie started talking about that and got that out of the way, we could then get on with the business of managing the cancer. And I think what's happening now, and it happens all the time, is that you've got to deal with things and then you can move on. You okay?
Yes, no, that's what it's about now for me. It's about getting better, continue to get better every day, and that's what I do, and that's what I hope for Aboriginal and Torres Strait Islander people. It's my great hope for that.
Thank you. I think, Archie, for me, you mentioned a word that I'd sort of written down here, resilience. And I think our people are resilient.
Yeah, that's true.
We thank you for sharing your story.
Thank you.
The lung cancer, the Lung Foundation has a DVD of Archie Roach surviving lung cancer. I'm not sure if they're available out in the main session. They are, so if you, and also you can download it on the website as well. So I think we'll just take a moment now to ask the audience if there are any questions for Archie and or for Dr. Irving. And I think for me, both this session and the previous session, it takes a strong Aboriginal person to come forward and to deal with and to accept the cancer and then actually move forward. To be able to do that, you need people around you. You need friends, you need family, you need community. But when you get the courage to move forward, you need wonderful health professionals like these 2 people that have supported our Aboriginal people today. And I think that's what we need more of. And I personally thank you for supporting here and hope that the sorts of things you do can be modelled by many other health professionals. So I think just on that note, any questions, and I'll just grab a tissue. We have one here, thank you.
Hi, my name's Nikki. I actually work in the southwest of WA in a little town called Narrogin, which is about 200 k's south of Perth. I wanted to ask you, or both of you even, do you think we really need to educate our GPs that are seeing people like Archie and people like Annette before to maybe ask more specific questions? So rather than saying, so how are you going? What can I do for you today? Saying, have you got a cough? Have you had shortness of breath? Have you got any lumps anywhere? Have you got anything that, being more specific about it? Do you think that would have made you perhaps say, well, yes, I do, or actually I meant to mention that, as opposed to, no, I'm okay, because that's what happens, isn't it?
Yeah, I think so. It probably would have helped instead of it, like the usual stuff. It was just, even my GP, bless him, he's a lovely guy, he's a wonderful guy. But I suppose just never really asked directly, things like that. He says, it's just the blood pressure and sugar sometimes, weight, and that was it usually. Yeah, just a checkup like that. Yeah. So I'm sure if a more specific question was asked, I might have weakened. Yeah, I might have said, yeah, well, I've been short of breath and coughing a little bit lately, and yeah. I don't know what Dr. Irving thinks. Yeah.
Yes, I think empowering people to actually to talk about something is really important. So I think my colleague Quan would say the same. It's our role as healthcare workers to actually highlight that new symptoms, particularly cough, is abnormal. We want to know about it.
Because often they'll say to us, ask open-ended questions so they can give you the answer, but you don't get the right answer. So you need to ask a more narrow-focused question.
Yeah.
Any other questions from the audience? Yes, one here. You're right. You get
Glenda,
2 a day. I just want to let you know. Okay, that's a quota.
It's a question for Lou, actually. It's Glenda from the Lung Foundation. I just wanted to ask if there's been any research or any outcomes in the targeted therapies in the Indigenous population. Do they have the molecular profile as what's been tested so far?
I don't know. Quan, do you know?
Quan?
No. I'm sitting here, I've learnt an enormous amount today. I feel guilty that I haven't even thought about that question. What we need to find out.
Yeah.
And particularly for Indigenous women, I think, and exposure to cooking fumes and so on.
Thank you, Alex. Yeah, Tom.
My name's David Copley. I'm from Cancer Council South Australia. Thank you, my brother.
Thank you, Dave.
Something you spoke about, I'm also a cancer survivor like a few other people here, that dark place when you were told and you went to that dark place.
Yeah.
I went there as well, and I think and I've had the great privilege of sitting with this man at the table and talking about some awesome stuff.
Yeah.
But what mainstream professionals don't understand is in our language, there's no word. Cancer's a death sentence. And they don't understand that dark place we go to, and they think because we're educated people, but the culture takes over. And I think if we have more discussions about when we diagnose Aboriginal people, where they actually go to, when they tell them, it's going to help with the treatment. Because I reckon it was probably, I don't know about you, brother, but about 4-6 weeks to get out of that that dark place.
Yeah, no, you're correct.
Yeah, and I think we need more discussion around mainstream, and thank you for sharing.
No, it's what it's about, but we share.
We might have one final, we have 2 questions. Yes, you're right.
It's more of a comment for Archie, and I just wanted to say that my husband buried your grandson at the Thornbury Church, the little baby, a few years ago. But you know, you've brought joy to a lot of people over many years through your music. When you lost your wife, we grieved with you.
Yeah.
When you had your stroke, people grieved as well.
Yeah.
Through this here, other people have grieved with you as well. But I think that the encouragement, don't ever underestimate your story at the moment, because you've helped a lot of people through this, what you're going through and what you've done, and telling your story, the amount of people that you've helped that are going through the same thing, and particularly our Aboriginal men that you've helped to talk and to get treated and to go to the doctors. They've seen the courage that you've taken, and you're instrumental, and you're being used to tell for other Aboriginal men to go and get their story and get treated. So never underestimate what you're going through, because people have been watching you, and people have been grieving with you, and people are following in your footsteps in their treatment as well. So I just wanted to make that comment.
Thank you, Ginger.
And if it's okay, we'll just take one final question. Where's the gentleman? Oh, right here, thanks.
Thank you. My name's Nev Reyes. I'm with Woodchopping up in Cairns there, and just recently moved into tobacco cessation, healthy lifestyle. And as everybody had already made comment there about a lot of the sort of journey and effects that you have supported for a lot of our Indigenous men especially. I just really wanted to, I seen you outside there, and I just had to come and say, I was really delighted to see you, because I hadn't seen you for more than 30 years.
Yeah.
And a lot of people don't know this story. And I think this is really the makeup of your strength and energy, is the fact that you devoted your time and effort to come all the way up to Cape York, right up to the tip of Queensland, and shared in health forum there and with the schools. And then you also went out of your way to come down to a little community named New Marpoon, and I set up a loader truck under a lamp light.
That's right. Yeah.
And you sang to virtually everybody.
Yeah.
And I think that, to me, is really about the spirituality, and the spirits, and our belief is our family is always with us. And I think the things that you've done over the years has really allowed you to continue on, because if you do things for a lot of people, it always come back. That's our culture.
That's
you
right.
know?
That's right.
So I just wanted to share that with you, and I just really want to thank you and have the opportunity. I've done a lot of stuff. We mentioned about doctors there.
Yeah.
I actually did a video recently training medical doctors and nurses how to present to Aboriginal men, and also deputy chair on men's health right now up in Cairns.
Yeah.
So over the years, there's a lot of stuff that's still not happening for men, but I think people like yourself, Archie,
And yourself too,
Yeah.
bro. Thank you for what you do too, bro.
I just like to thank you. And I lost a lot of family. My uncle Frankie Reyes,
Yeah.
in 1973, won the Melbourne Cup in Australia. Nobody people know that. He's an Aboriginal man.
Yeah, that's right.
He died of cancer.
That was your uncle.
That's my uncle. That's my father's. My father's the last standing male man of more than 20 men, because we have 3 families from my grandfather.
No.
And all my family, my aunties, all died from cancer as well.
No, don't.
So, and my sister, my only sister, big sister, and she was in medical health all her life as well.
Yeah.
But I think, the strength of it is like people like yourself and like people in the room here
Yeah,
are
everybody here
doing
too.
this. And I go through the same journey, angry.
Yeah.
My family's at stolen generations as well. And, not being recognised for traditional owner in my own country, things like that, it's very hard. But anyway, thank you, and be a positive note. Thank you.